This last year has hit the NHS hard, and not just on the COVID front line. Non-COVID services have been badly affected too. By the end of February this year, 4.7 million people were waiting to start NHS treatment, the highest figure since records began. Over the next half hour, I'll be speaking to a special panel of guests about what life's been like if your case was deprioritised because of the pandemic. Let's introduce them all now. I'm joined by Craig, whose daughter Kelly died from bowel cancer in June last year after her treatment was interrupted. Antoinette is living with blood cancer, and cancelled appointments and changes to her medical care have seen it spread further. Cara is a mental health nurse and eating disorder patient. Her treatment was temporarily cancelled due to COVID and her therapy moved online. Kevin and Donna have an autistic son, and the changes of the last year have caused an enormous amount of stress to their family. And Bridget's son Tom suffered a devastating injury to his spine last year. COVID has meant he's been offered less than a fifth of the physiotherapy rehab he needs to make the best possible recovery. Hello to all of you. Thank you so much for joining the panel this afternoon. Craig, I want to start with you and your daughter Kelly. Tell us about her.
Kelly was a very bright, very beautiful young woman. She had a 6-year-old son, and she was the kind of person when they walked in a room, that room would light up. She had a tremendous sense of humour, a tremendous sense of fun, and was a very committed mum as well.
And she was diagnosed with bowel cancer. She'd been going through treatment, and then in March of last year, as the COVID crisis was unfolding here, what happened?
She went into hospital as usual for chemotherapy, went through the process of having her bloods checked, and just before chemotherapy was due to start, she was told by the doctors that due to COVID, they weren't going to treat her, and they recommended that she went home for 12 weeks to self-isolate in order to protect herself from the disease. And by early May, she was then given the prognosis of 2 to 4 weeks to live, and she died on the 13th of June last year.
What impact did that pause in her treatment have? I mean, we all know when it comes to cancer, the importance of getting treatment in a timely fashion. What impact did COVID have on Kelly?
I think the principal impact is the chemotherapy was never going to be a cure. Kelly was initially diagnosed as stage 4 anyway. But what the chemotherapy was doing was effectively holding the cancer at bay. So even though it was still spreading, it was very, very slow. And Kelly had always responded very well to chemotherapy. So once that was actually stopped, there was nothing effectively holding the cancer back, at which point it spread throughout her entire body very, very quickly. And like I said, within 6 weeks, it had got to the point where there was nothing that could be done other than palliative care for her.
She was living with you at the time, but it got too much and she had to go into a hospice at the end, which is something you didn't want to happen, wasn't it?
Absolutely. Me and my wife and I, we did the very best that we could. Obviously, we were under lockdown restrictions, and we did have some excellent support from Macmillan and also from the district nurses. But it got to a point where Kelly was, she was in pain, and due to the liver failure, the swelling on the brain meant that her cognitive skills were very badly impaired, and she was sort of effectively a risk to herself at that point. And as her son was living with us, we really didn't want him to see that. So we did eventually arrange for her to go into a hospice on Friday the 12th of June, and she died 14 hours later.
And to compound the agony of that, because of coronavirus restrictions, Craig, you weren't able to be with her at the end.
Correct. The hospice she went into were actually very good because there was meant to be a 48-hour period after a patient was admitted before they could have visitors. But the hospice obviously assessed Kelly and realised that she didn't have long at all. So they allowed my wife to visit her on the afternoon she was admitted, and then they called her at 4 o'clock the next morning to say that the end was very close. But because of the restrictions, my wife had to go through that on her own, as I was not allowed to be there.
Devastating for all of you, for you and your wife, and for Kelly's little boy. How is he doing now?
He is remarkably resilient. We still see a lot of him because we help out his father with the childcare, just to try and make sure that he has some stability, and also to, for Finn's father, it's a major transition for him as well. So we're all working together and trying to make sure he feels safe and loved, and he's coping remarkably well.
Oh, Craig, for now, thank you for telling us your experience, Kelly's story. Let's bring in Antoinette now. Antoinette, you have incurable blood cancer. What has COVID meant for you?
COVID's meant for me pausing my treatment. Well, I was supposed to start a particular treatment, which would have meant me coming up to the hospital about 3 times a week. But because of COVID, my doctors felt it was better that I went on a tablet-based chemo treatment, which would mean obviously just taking tablets at home with fewer hospital visits. I started on this particular treatment, but unfortunately, it didn't do very well for me. My cancer, unfortunately, progressed quite rapidly. It spread to my spine, and it collapsed vertebrae, as well as caused, which I recently found out, instead of having 4 fractures, I have 13 fractures as a result of the progression. Even though they tried to prevent me from coming into hospital, it turned out that I was actually admitted for 3.5 weeks. And I had many admissions after that, even during the COVID crisis.
And you are living in severe pain now, Antoinette.
Yeah, the pain, there's no words I can describe. I've been referred to palliative care for the pain. I am in a back brace to try and help me to support my body and help with the pain. I need physiotherapy, but obviously because of COVID, I've had no physiotherapy at all. So this is the position I'm in at the moment.
You're on, I think, is it your 17th cycle of chemotherapy?
I've actually had more than 17 cycles in total. This is my 10th cycle, but I've had 5 lines of treatment over 9 years. So I've had at least 30 cycles of chemotherapy throughout my lifetime.
And if it hadn't been for the pandemic, how different would your treatment plan have been, and your expectation of where you would be now, Antoinette?
Well, I would have been able to start the original treatment that I was supposed to start. The progression may not have happened. And even if it did, I would have been able to, the doctors would have been able to take care of the orthopedic side of my back, like my spine. I've only got to see the orthopedic doctor twice. My appointments just kept being put back because of COVID, and shortages. So I have not, I should not be in the brace now, basically.
Antoinette, thank you. Let's bring in Cara now. Cara, you have had anorexia for more than half of your life. You had a relapse in the latter part of 2019, is that right? And you were getting treatment. Then what happened?
So I was in an intensive treatment program, which is sort of sits between inpatient and outpatient services. So I was going to the clinic every day for supported meals and therapy groups. And then we just went in one day and were told that was the last day that we could be there. And that was the day that we went into the national lockdown. And then ever since then, everything that I did was virtual.
And that shift to doing treatment virtually, how did that affect you? Was it helping in the same way as you'd hoped it might?
No, definitely not. My individual therapy was brilliant, and I think that they did really the best that they could in really difficult circumstances. But going from sort of daily support and having all my meals supported and having them portioned out by a dietitian and things like that, to then suddenly having to manage that at home by myself was really difficult. And I was also only about halfway through the program when that happened, so I had to do the other half of all my weight restoration at home by myself. All my meal planning and portioning and things like that I then had to do all by myself, and I hadn't had to do that for quite a number of months independently up until that point. So to then have to go and do that by myself overnight was really challenging.
And I wonder how much a factor social isolation is in compounding what you're already going through.
Really significant, yeah. I think eating disorders just really thrive in that sort of environment of being socially isolated. So it kind of I didn't just lose my professional support network, I lost kind of all my personal support network at the same time. So I felt like I kind of went from having this really intensive support from sort of every area of my life to having almost nothing, it felt like.
You also work as a mental health nurse, so you know firsthand the pressures that the system was already under. Now we know that eating disorders in both adults and children have soared during the pandemic. How is it going to be able to cope in the months, years ahead?
That's a really good question. I honestly don't know. I think there needs to be a significant increase in funding, particularly into adult eating disorder services, because they do seem to lag quite far behind. Without that, I honestly don't know how they're going to kind of be able to pick up the fallout from COVID.
Yeah, and as we can hear from all of your stories, that fallout is hugely significant. Let's bring in Kevin and Donna. Your son Angus was diagnosed with autism last month. What impact has coronavirus had on him?
We had a really big impact as soon as we went into lockdown, really, because his whole world changed and his environment changed, and we hadn't at that point we hadn't got a diagnosis, which made it a bit more difficult, but his whole world changed really. We had to change the house in terms of getting everybody working space so he could work from home and we could work from home. His routines changed, everything just completely shifted really, until he sort of relaxed into it, and then we got back into routine. But then towards sort of June, he was back in and out of school. So again, it was changing routine backwards and forwards again. And I think he felt very overwhelmed. From a social aspect, he was quite happy to be at home. And I think if he'd have stayed at home, that would have been fine. It was the constant in and out and the changes to his environment.
Yeah, it's interesting you say that actually, isn't it? Because while homeschooling was difficult for many, actually, in Angus's case, being in a familiar environment with that stability of home, without a lot of unfamiliar people around, reassuring. And yet those transitions, the lack of routine, the constant change, very, very difficult to deal with.
Yeah, he found it extremely overwhelming, and we had quite a few problems. We didn't realise at the time that he'd been self-harming from almost since lockdown started. He had alerted school at one point that he was having some problems, but we just thought it was anxiety. And then in September, when they went back again, it became very apparent. He actually went to the nurse and said he was having a lot of problems. And then he self-harmed at school. So that was a very big crisis point for us.
And what about that process of getting a formal diagnosis for him and then the subsequent support that is necessary?
Well, the diagnosis and the CAMS for his mental health issues were two separate services, really. So for the diagnosis, that's been going on since before Christmas 2019, and it normally takes around 2 years for a diagnosis. So I think we did okay to get through in 18 months. But when we did have this emergency self-harming issue, when we rang up the autism team, they had to refer us to the CAMS team for young people, who then got the on-duty therapist to call us and gave us some safeguarding help, so put a safety plan in place. But then it wasn't until after, it was about 4 or 5 weeks, or after we had an absolute crisis after the school incident, that we got any help. We were just told to go to A&E, which again is very difficult, which we didn't feel was the right thing, but we would have done.
Yeah, very difficult decisions that you've been having to make. Kevin, I wonder how you and Donna have coped during this period with the fear, the uncertainty, and this very long process to get to a diagnosis.
I think it is the change that has affected all of us, the chopping and changing between lockdown, back into school, out again, back out again. And that sort of constant change has meant that I'm autistic as well, and so for me and Angus, there's no time to settle into a new routine before it's changed again.
But also, not having a diagnosis meant that we couldn't access the services that we needed to, and to get the support we needed.
And is that support there now, Donna?
I would like to say yes, but I don't think it is. We are referred, no. In short, for young people, there isn't. We have a fantastic group called Space for Autism in Macclesfield who CAMS refer to, but Space for aren't commissioned to provide these kind of services for young people. We really need CAMS support and help.
Kevin and Donna, thank you. Let's bring in Bridget. Bridget, you have also been battling to try and get the right kind of care for your son, Tom. Now, tell us about Tom. He had a horrific accident last summer. What happened?
He had a serious spinal accident. He dived into a swimming pool and was taken to King's for 4.5 months. But because of COVID, the staff were exhausted. He then became extremely ill. It took us 4.5 months to get him into a spinal unit, but there is currently almost no provision. So all, certainly young adults, but I believe adults with a serious spinal injury are now sent to care homes, often geriatric care homes, where there's no rehab facilities at all. So we have had
care homes. Tom's a 20-year-old man.
Yeah, and so you're in a geriatric care home because, of course, there are currently a lot of spaces in care homes, and they need funding as well. And so a direct result of COVID is that young adults like Tom are in completely inappropriate settings where they receive no rehabilitation. So Tom was expected after 12 weeks in Stoke Mandeville to go to a care home where there would be no rehab. So we've had to just do a massive fundraising campaign, and then he caught COVID in hospital and was in complete isolation for 5 weeks when he saw nobody, because the hospitals are at breaking point, and it's part COVID, it's part a reaction to being underfunded in the first place, but they have very little money and they've got almost no room for manoeuvre. So we've had to get him. He's in a rehab centre in Sheffield, which is 5 hours away from us, and we fight every day to get the funding for him. And if I can apologise for saying, please look at tomlazaridis.com, where you'll see his story and what we're trying to do for him and everybody else with a spinal injury of his age that needs looking after.
Yeah, we're looking at pictures of Tom now before the accident. He was incredibly sporty, active young man. To find yourselves now in this position, and then the frustration of not being able to get him the help that he needs. How has that affected you?
Well, I think, he's got 3 siblings, and everybody has just, one realises that one's life spins on the toss of a coin, and we have to fight and fight and fight to get him the rehab that he needs so we can get him home. It's even a fight now to get him home because there's new COVID rule of practice, and you have to show that home is a better environment than being in a care home. But you don't know what you have no idea what the criteria for that is because you're not supplied with any of this documentation. So we're currently fighting to get him home. But one can't get an occupational therapist into the house to come and see if it's suitable. So it's just a constant battle.
Yeah, so not only this battle for treatment, but also that separation from your son at a point when he needs his family the most and you want to be with him.
But also when listening to everybody else's stories, because one feels very much like you're completely isolated, and then you hear about the trauma of people not being able to access cancer treatment or mental health treatment. I mean, there are so many of us within the situation, and it's very hard to get one story out, and one is constantly fighting. Our GP is brilliant. Our MP's been absolutely fantastic, Helen Hayes, but you fight every day to try to get him home and try and get the treatment that he needs.
And I think what is so devastating is when we look at the figures, we hear your stories individually so traumatic, and yet they are not in isolation by any stretch of the imagination. Craig, if I can come back to you, to be going through this unimaginable tragedy, the grief that you've gone through, in a point at which we are kept away from support networks, from family, from friends, from loved ones, how have you coped?
The principal thing we've done to cope is to try and make at least a small amount of good come out of Kelly's loss, because what has happened to her is unfortunately not an isolated incident. So we started a campaign last July called Catch Up with Cancer to ask the government to put the necessary funds in place to support cancer services. Because even at that point, the prediction was that 35,000 cancer patients would die due to lack of treatment. And we've been working on this ever since. We've got 400,000 signatures on a petition. We've got a letter signed by over 400 doctors and oncologists. We have the support of hundreds of MPs. Yet the latest response from the government is this campaign is basically we're just a bunch of scaremongers, which to me is, well, it's disrespectful and also grossly inaccurate considering, what we're actually trying to do. Cancer Research UK recently released figures that indicated that over 43,000 people are walking around with cancer and they don't even know yet because they can't get onto the cancer pathway. So what I would say really to the government is, follow Kelly's example, be active, do something about this, try and help to the point where if the government feel that we are genuinely a bunch of irrational scaremongers, then I would invite Matt Hancock and Simon Stevens to join me and Professor Pat Bryce to debate this in public on live TV. We have the strength of our convictions and we have the data to support that. So we feel that we can put a rational case across to help cancer patients.
Yeah, and you raise a really important point, Craig, that it's not just existing cancer patients, it is those that haven't yet got a diagnosis, are either too frightened to go and try and see a doctor and get a diagnosis, or are waiting for those diagnostic procedures. Antoinette, a final thought from you, aside from the knock-on effect this has had on your medical treatment, what about the mental health implications of this, going through this when your access to those broader support networks is taken away?
It's just been horrendous. I mean, my family and friends know me to be genuinely a strong person, but this has to be, aside the treatment, one of the hardest things I've ever had to deal with in my life. Lucky for me, I managed to find a charity called ACLT, who, I felt I could just pick up the phone and just call at any time because, I just started to feel that, I didn't want to keep bothering you know, family and friends all the time, because they had their own problems and struggles to deal with. So mentally, this has really affected me mentally, and not just me. I have 2 young children as well. So for them, it's just been, you know, a massive impact on me, myself, and my family.
Cara, I wonder how you are now and what your hopes and needs are as we begin to emerge from lockdown, as the world starts to open up again. What do you need to support you?
I'm doing okay, actually. So I was discharged in March for what I hope is the final time. I've been under the service a few times now. I feel relatively confident that I'll be able to stay out of the service now that I've kind of managed to navigate recovery in such difficult circumstances. So I guess what I need is for the world to open back up as safely as it can in order to sort of build up my support network that exists outside of mental health services.
And take things slowly. Cara, we wish you all the very best for that ongoing recovery. Thank you to all of you for sharing your stories with us today. Craig, Antoinette, Cara, Kevin and Donna and Bridget, thank you all very much indeed. It is not just the impact that this has had on the COVID frontline within the NHS. So many people have been affected by treatment, by support being paused during the pandemic.